reading through a 400-page haystack looking for that golden needle. That's exactly what you did.
Yeah, that's what I do almost all the time. I have just a PDF file on my computer or on my tablet, and I just sit there and just leaf through every single page. Because these things, you can't even search them, using keywords most of the time. But that's really all journalism is being curious and being willing to do the work it takes to find that needle in a haystack. And in this instance, it was, 2 paragraphs really, or 3 paragraphs in amongst 400 pages of briefing notes provided to Theresa Tam by officials in her own ministry who were trying their best to warn her and the health minister that the coronavirus was indeed spreading person to person in Wuhan, China. And they were doing that as early as January 15th of 2020.
Now that's important because, of course, Taiwan knew something was fishy even in December. They sent a crew right into China. They rang the alarm. They shut down the flights. The rest of the world wasn't quite as alert, but even as you mentioned, as early as mid-January, Canadian public health officials were ringing the bell. Let's put up the first document that on January 14th here, the risk assessment, public health assessment of, what's PHAC stand for again, Sheila?
Public Health Agency of Canada.
Got it. So their assessment of public health risk to Canada associated with the virus in Wuhan, China was updated as of January 14th to consider the potential for exposure beyond the Huanan seafood market and limited human-to-human transmission. So until January 14th, people were believing the World Health Organization, Chinese Communist Party cover-up, which is, oh, don't worry about it, guys. There's nothing. There's no human-to-human transmission. It was just, bats or something in the Huanan seafood market. But on January 14th, the Public Health Agency of Canada said, no, that's not true anymore. We're going to revise our thinking. Theresa Tam had that info on Jan 14, 15, but she didn't follow it, did she? She chose to follow Beijing's guidance instead of Canada's guidance, didn't she?
Right. So they updated the information on the 14th. She's presented with like a situational report on the 15th with this new information that it is spreading person to person, that a husband who worked in the seafood market gave it to his wife who had never been to the seafood market. She had that information, but not only did she have that information, she also had other credible information coming from the American CDC, as well as UK researchers who were saying this is far worse than what China is letting on. But Theresa Tam chose to disregard that information from credible sources and instead opted to go on information from the World Health Organization, who was getting their information from China. We know that as late as January 26th, so 11 full days later, after Theresa Tam's own officials were warning her about how the virus was being spread, she was still tweeting out that it wasn't spreading person to person at all.
Yeah, so it had been 10 days since her own staff said, Dr. Tam, no, you can get it spread. And by the way, the reason she tweeted that out on January 26th, Sheila, is because the day before, Ontario's provincial government had a press conference saying, yikes, we've got our first Canadian patient. And wouldn't you know it, his wife got sick too. So obviously, it was being transmitted patient to patient because a man got it, then his wife got it. The idea that on January 26th, she's still towing the World Health Organization line, despite the evidence in our own country and 11 days earlier, the advice from her own staff, she was ignoring independent Canadian science and substituting Chinese-backed WHO propaganda. She doesn't work for Canada only. She works for Canada and the WHO, and where they conflict, she chooses China as WHO instead of Canada.
Yeah, and it conflicted almost immediately, didn't it? This is the first pandemic that we've really had to deal with since Theresa Tam became the head of the Public Health Agency of Canada. This was the first time where she had an opportunity to show her allegiance to Canada as opposed to the World Health Organization, and she didn't do what we are paying her to do. She opted to side with the World Health Organization, an organization that refused early on to declare a pandemic when the world needed a pandemic to be declared. And she herself is guilty of spreading the misinformation she now claims to be fighting. I mean, how many times did she say that Canadians should not wear masks? When eventually she had to flip-flop on the issue of wearing masks and gave an interview very recently to Rosie Barton saying the new normal in Canada is going to be wearing masks. Theresa Tam isn't using scientific evidence to protect Canadians. She is political in nature, obfuscating about masks because her boss, Justin Trudeau, gave them away, and telling Canadians that the virus wasn't spreading person to person because her other bosses at the World Health Organization were kowtowing to China.
That's an excerpt from my daily show, the Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.